Party has advocated for the implementation of the Affordable Care Act, yet your Board of Education recently voted to reduce and cap the hours of substitute teachers to a level that would not require health care coverage as prescribed by the ACA. As a commissioner, would you propose that the county implement the same policy for temporary and part-time employees to save money?
Not to the extent that the county may have an alternative, a better alternative. And in Chatham County Schools, the decision was made based on a number of factors involving the funds that it would cost to pay for the Affordable Care Act, and the fact that a lot of our employees work on a part-time basis, a temporary part-time basis, which makes it very difficult to calculate the amount of time that they actually worked. So we were constantly going to be recalculating individual people's year, because you have a year where your salary is calculated. So if a teacher worked for 2 months because someone was on maternity leave, and then didn't work again until the very end of their year, say October to October, we would have to go back and calculate for that individual, calculate for that individual how many hours they had worked. That was such a laborious task that it would require an expenditure of funds on the county level that we couldn't justify, and the number of people that it affected was so small that it was determined that it was a better use of our resources at this time to have those individuals capped. But we do, but again, as we're an employer, to that extent we were acting as an employer. I absolutely support the Affordable Care Act, and I'm glad that you all use that term instead of that odd term that has been thrown around about President Obama. But absolutely.
I think the question was, if we had part-time help that wasn't getting enough hours in, would you recommend the same thing for our part-time help on the county staff?
I answered that.
We're running low on time, and in fact,